So this is doing biometry with immersion. And you use immersion because you're going to use saline solution to connect the ultrasound probe to the eye versus doing applanation. How we do that is with a Prager shell, which is what this is. So a Prager shell simply goes, you anesthetize the eye. I always recommend 2 drops, not 1. If you do 2 drops, then the conj gets anesthetized, otherwise it's uncomfortable. So this sets on the globe, and the probe sets in here. Now something that's important to do, if you look at this, they make probes and these Prager shells to appropriate the right probe. So this is a little bit bigger probe, it fits in, it's got some things that it sets in there. But I want you to notice that where this comes up, you want the probe to go just up to where that line is. If you actually make the probe go to the line or past the line, it won't acquire because it throws the system, throws the software off rather. So just be aware of that. So it's ready to go. You just use a lure lock IV extension, and then we use saline solution. We use IV solution that I just take from a bag that we have and stick it in here. That works. And then you just have to make sure that your settings on your A-scan machine are set to immersion. So when I hit measure here, it's going to give me a menu on this machine here, and it says immersion on. If you try to do a scan with immersion on when you're doing applanation or vice versa, you'll get numbers that just don't make any sense. And it's actually hard to acquire. When you have immersion on in your immersion mode, you'll get a spike and you'll get acquisition very rapidly. So, and the reason again is that since the eye is setting off of the probe, and if you don't have an opaque cataract, the patient can actually see the fixation light, so it helps align it. If they can't see the fixation probe, then what you're going to have them do is fixate with the other eye or look straight ahead, and then you have to line this up with what their visual axis is to get measurement. But then acquisition usually is really quite simple. So because we're going to fill this cup with saline, and it's open back here, you wouldn't really be able to have somebody look straight ahead. So what you do is just have them lean their head back slightly. You only need to be up this far, and then that's enough where you can get fluid on the end of the probe. And it is important to, maybe a little higher like this, but you do want the whole front face of the probe to be covered in fluid. That can be an error you can get if there's not enough fluid. It won't give you a good spike and it won't pick up a measurement. Everybody gets wet and frustrated. So mirale luz again. Mirale luz. See? Okay, so sometimes you just pull the lower lid down and it'll get out from underneath there, and that helps it hold. And you actually really only need to hold this on. I'm not really holding it on the eye, so you don't have to push on the eye. The eyelids really hold it, which is something that you learn as you go along. So I'm going to put fluid in here, and then you can see the spike will show up. And then I'm going to hit the button to have it acquired. And so I get a nice spike there, and all my measurements and a good low standard deviation. So you're going to just set this tissue there, pull it off, and you're good to go.